one of those lucky people who had a dream as a teenager, and as an adult I actually got to live my dream. When I was in high school, my best friend's mother had rheumatoid arthritis, and it was then that I knew that I wanted to be a physician who not only brought the best of medical care to patients, but also cared about them and their families. Unfortunately, in 1990, I was diagnosed with non-Hodgkin's lymphoma. I was too sick to care for patients and had to close my practice for 10 months. But within weeks of my diagnosis, I realized I was learning so much that would be helpful to patients. I had the background, the medical knowledge of a physician, but now I was having the experiences and the insights of a patient facing life-threatening illness. And just instinctively, I started to write what I was learning. Over the weeks and months of my chemotherapy, this little manuscript turned into a full-fledged book, Diagnosis Cancer. The chemotherapy worked, and I returned to work at my office. But a few months after I returned to my office, the cancer came back, and I was forced to close my practice permanently. I returned to writing. I started exploring and writing about all aspects of survivorship, how illness affects family, dealing with recovery after completion of treatment, dealing with fatigue during and after treatment. And I found that there was a world out there that needed to be written about and shared with patients. I found myself in the unique position of having a very useful perspective for helping patients. And as my works were published, I started receiving calls asking me to participate in workshops, consortiums, work groups that were developing guidelines for helping cancer patients. And what I discovered was a broad arc of the healing circle that had been invisible to me when I was so busy in my practice. And I became reintegrated into the Guild of Healers. A lot of times people said to me, especially when I was sick, "Why are you doing this?" I was in a position where I could help patients understand how they could be effective patients and help their doctors and nurses care for them. So I could speak to them as a physician survivor and advocate for physicians and nurses. I also felt that I could advocate for patients because I'd been there, but with our shared background as healthcare professionals, doctors and nurses really would listen. The most important reason that compelled me to do this work was that I'm a physician. I'm a doctor, and helping others is what I do.